Hi, I'm Jaida Anekwe. I'm going to be diagnosing you today. What's your name?
I'm Dr. Shehu Gandhi. Yeah, you are welcome, Jaida. You are welcome.
Thank you. And what is our patient's name?
Me sunan shi.
Okay,
The
thank you.
patient's name is Abdurrahman Yusuf.
Sorry, can you repeat that one more time?
Abdulrahman Yusuf.
Okay, thank you.
Thanks.
So, can I ask you some questions?
Yes.
Okay, thank you. So, can you tell me about the patient and his family members?
I didn't get you. Speak a bit loud, please.
Sorry, do you mind telling me about the patient and his family members?
Okay. Me ma kika ce sunanki mama? Rabi'atu Yusuf. Okay. The patient's the mother's is he's been accompanied by his mother as the informant. She is Rabi'atu Yusuf, and he come here with complaint of fever, chills, and rigors. Chills means feeling extremely cold, while rigors is when the body used to shake. The body shakes when you are feeling cold. So he comes with fever, chills, and rigors for 2 days duration.
Okay. Has the fever been on and off, or has it been getting worse?
Kika ce zazzabin ya yake mishi? Sannan kuma yana zuwa ya je ya zo ne ko kuma okay. Yes, according to the mother, the fever is on and off. That is intermittent fever.
Okay. Thank you. And has there been any other sites of unusual pain?
Shin akwai wani wuri da yake mishi ciwo ko yake jin wani zafi? There is no pain in any other part of his body.
Okay. Thank you. So do you mind if I just quickly take his temperature?
Okay. Going by the records, his temperature is 37.7 degrees centigrade.
Okay. So I have suspicions as to why he's not feeling well. Do you mind if I ran a rapid diagnostic test for malaria?
Yes, that's good. So, and if it is malaria, what did you expect the result to be?
I expect a positive result.
Yeah, excellent. Yes. You make a very beautiful diagnosis going by the patient's symptoms of fever, which is intermittent, which goes on and off, and also chills and rigors is in keeping with malaria. But if you see my patient now, you can see him yawning, opening his mouth. What do you think is responsible?
He's experiencing some exhaustion. Is he?
Yawn? Yes. Any other contribution?
Yeah, so he could be having a bit of malnutrition. That could be causing the weakness. Do you mind if I check his blood count for his hemoglobin?
Excellent. You are making sense. Yes. If you see a person just yawning, it's either he's tired, hungry, or very satisfied. But from in this point is the patient is hungry. So probably there may be malnutrition. So the patient is hungry, just giving us some sign. Is excellent. So it's a nice answer. What you said is correct. So is there any other thing you would like to do, or how can you treat the malaria?
Yeah, so um, his malaria doesn't seem complicated, but I would like to run a blood smear if that's okay with you.
Yes, yes. When you run the blood smear, you'll do a blood microscopy, culture, and sensitivity. Even just on microscopy, when you visualize the smear under the microscope, you will see the parasite. Mostly not the parasite per se, but you see either the egg of the plasmodium parasite, or the wings, or some parts of the leg, some parts of the parasite per se, mostly the egg. That's what we call the ova. So when you see the ova, which is in keeping with that of the plasmodium parasite, it tells you that yes, this child is suffering from malaria. And also, even on microscopy, they can give you whether it's 1 plus, 2 plus, or 3 plus. It's 1 to 2 plus is meaning just a simple malaria. So that is good. It will determine how you go about treating the patient. So going by our symptoms, just as you say, it's not complicated because there is no any symptoms or suggestive of complication. So if this child is suffering from simple malaria, just as you said, how are you going to treat the condition?
So I would give him an ACT treatment for his malaria. And for prevention, I would suggest him wearing long sleeves and staying under mosquito nets when he's outside.
Yes, that's good. That's good. ACT, atomizing combination therapy, is the first line treatment for simple malaria. You give it oral, you usually give it over 3 days. So he will be fine. And also is good, just like you mentioned, to give the parents advice on preventive measures so that the child will not come down with malaria again. So just like you say, in addition to what you have mentioned, you will also advise them to cut down the bushes around them and drain all the gutters that are close to their houses. Because here we don't have good drainage system like in USA. Our poor drainage system provides the breeding ground for the mosquitoes, where they hatch their young ones and they come for blood meal within our households. So it's good you advise them also on the sanitation. And this child is under the age of 5 years. That's why it's good when you are asking for the symptoms, you should also ask for the age of the child. Malaria usually affects pregnant women and children below the age of 5 years. So in those groups that are usually prone to malaria, in the endemic zone means where the malaria is usually domiciled within those countries. You find out that in those countries, malaria is usually diagnosed on daily basis, is common within the whole communities. So we usually give them what is called malaria prophylaxis. So you prophylaxis are medicines, they are anti-malarials that are being given to children under 5 and those that are at risk of contracting malaria, just for preventing them from contracting the malaria. So that's what we call prophylaxis. It's nothing big deal. I'm very happy with the way you attend the answers. Thumbs up.
Thank you,
So
doctor.
is there any other question you may wish to ask or any contribution you may like to make?
Yeah, so I would like to see his hemoglobin levels with the blood count.
You say?
His blood count, I would like to check his blood count for his hemoglobin levels.
Okay, okay. Yes, yes. That's good because during your examination, from your physical examination, you may have picked palo. You may have picked that the child is pale, maybe from the eyelids or from the oral, that is from the buccal mucosa. When you look at the color is not that red, it's pale. So it suggests that there could be anemia, and also symptomatically he may come down with some symptom of anemia. When you do the full blood count, you will see either red blood cell or white blood cell, or increase in the white blood cell. In malaria, usually there is hemolysis, so you may see decrease in the number of white blood cells, which is called anemia. So it's very good to do full blood count. It's very good. It's interesting. And also, if you want to test for anemia singly, that is for the red blood cell, you do a test called PCV, packed cell volume. So it will measure only the amount of the red blood cells that are in the blood, usually measured in percentage, depending on the age. So if you do full blood count, apart from the red blood cell, it will also give you indices for other blood cells like the white blood cells, which are called the leukocytes, and also the platelets, which are called the thrombocytes. It will also give you counts of other, if there are other bacteria, you will be able to ascertain from the full blood count. You will see the differential counts in the white blood cell. So depending on which components of the white blood cell are elevated, are high, it will give you a clue on whether the child is having sepsis. That is sepsis when the infection got into the bloodstream. So that, so did you have any other contribution?
Yeah, so the results for his red blood cell count, did they show us severe, less than 7 or 7 to 9, or what were the results for that?
I didn't get you.
Sorry, for his red blood cell count, what results show for that?
Well, in this case, his spark cell volume is about 35%, which falls within the normal range.
Okay.
It's 32%. I mean, that is the packed cell volume, 32%. So the child is not anemic. It's normal.
Thank you. So is um, the parent aware of all the preventative measures that she can take for her child, including covering with mosquito nets and long sleeve and
Yes, she's aware, but I will still highlight to her this is what you tell her, so that she will buckle up, so that she holds deeply to the advice, because it's very important. If not, she'll still come back to the hospital maybe in the next 1 or 2 weeks. We have what is called relapse. There could be relapse and there may be reinfection. So it's very good for the preventive measures. She's well aware, and I will highlight to her all the advice you get.
okay, thank you.
Thank you. You're welcome. Nice being with you.